to healthcare and they just see antibiotics, or they see go to one chemist and that person prescribe antibiotics to them, or just give antibiotics over to them. They will want to use the antibiotics. So I just think overall what we need to do when it comes to response to or the use of antibiotics in conditions, not just Ebola or even in future pandemic, we need strong science. We need strong infrastructure, especially in low and middle income countries where we have limited engagement and also responses that are not really equitable. We need all these things to come on board for us to be able to protect this life-saving medication.
Countries, many Africans, don't believe in COVID-19. Not just Africans, even people. There is already misuse and abuse of these antibiotics before the pandemic, and there is already lots of research on antimicrobial resistance. Do you believe the pandemic increased the resistance to these drugs, especially in Africa?
I would say during the pandemic, there's a lot of pressure bottom up. Not just that someone from the top is making policy without understanding why people are actually misusing antibiotics. People are sharing or misusing antibiotics because of their circumstances most of the time. And we all know that some people community lack access to water. Some people, they have a lot of misinformation regarding vaccination. Some communities lack access to clean water. Wash is a major problem. There's nothing that is ongoing regarding that. That means that they are prone to more infection. Right? So I don't know, they are prone to more infection. So, but if you are just doing the awareness, so don't misuse antibiotics, that is not going to work. That's not going to be effective. We need to do a bottom-up approach, talk with people on the ground, what is the challenges, do more research to uncover all these things, and do proper implementation. And regarding the reason why people don't trust
co-advocacy and education on antimicrobial resistance. In 2019, the WHO also identified AMR as one of the major threats facing healthcare systems. Why do you and other authors on this publication feel that AMR as a pandemic is needed? Resistance, in that only 7 African countries have developed the National Action Plan on Antimicrobial Resistance. Dr. Adebisi, we are strengthening antimicrobial stewardship programs on the continent without a national action plan. But we have national